Now to developing news at this hour, state health officials sounding the alarm about the mental health of children and teens. It's so bad, they say at this point, they're looking to inform everyone about it, not only parents. ABC 6 News reporter Olivia DeRocha joins us now live in the newsroom to fill us in. Olivia?
Well, Tiffany, I spoke with one mother and she says this really is going to impact everyone. She says her 14-year-old daughter is currently being held at a state hospital emergency room because there are no beds available at a psychiatric facility.
Health officials in Rhode Island declaring a state of emergency for child and adolescent mental health as the domino effects of COVID continue.
It's been hard.
Sharika Randall says for the fourth time, her 14-year-old daughter has been admitted for a psychiatric evaluation. But this time there are no beds, so her teenager is being held at an ER until a bed opens up at a psychiatric hospital, which she's told will take weeks.
It wasn't the pandemic made things worse. It was the fact that the pandemic brought out what was already there.
Child and Family CEO Marty Sinnott echoing that statement, saying pre-pandemic, Rhode Island was already struggling with employing mental health workers, as many were leaving to other states for better wages. Also pre-pandemic, mental health issues were already on the rise. According to the 2019 Rhode Island Youth Risk Behavior Survey, 15% of high schoolers in the state say they attempted suicide one or more times in the year before that survey was given out.
And when the other parts of the system break down, then you see the like that balloon I was trying to tell you. You squeeze it in one spot, it's going to come out someplace else. And unfortunately, the lack of other preventative resources is what's created this real crisis.
And I reached out to a spokesperson for Governor McKee for comment. He says he understands the severity of this crisis, and in the governor's Rhode Island Rebounds plans, which was passed by the General Assembly, $7.5 million in pediatric grants to help children and youth get back on track was given for now. For now, live in the newsroom, I'm Olivia DeRocha, ABC 6 News.
Thanks, Olivia. And obviously, if you or someone you know is in crisis and needs immediate help, the National Suicide Lifeline is free. It is a 24-hour line with trained help on the other end. That number on your screen right now, 1-800-273-TALK.